So now let's look at two quality of life patient-reported outcome measures. I think measuring quality of life is such a cool thing because I believe that chiropractic has such an influence, such a wide influence on our patients' lives and in particular the quality of their life. There's so many things that indicates that. So why not measure it? There's a few studies on this as well that do show that chiropractic care definitely seems to improve quality of life. So it's one of those things that I'd highly recommend that you do and that you can document and discuss with your individual patients. If you're part of bigger patient-reported outcome measurement systems so that we can get this on a profession level and make a difference to decision makers, that is also excellent. So the two I want to talk about, two quality of life ones, is the short form 36, the SF36, and also this PROMIS system, this patient-reported outcome measurement information system. So let's start with the SF36. So the short form 36, or SF, that's what SF stands for, short form, is the most widely used generic outcome measure that qualifies health status, so the quality of life, health-related quality of life. So it contains 36 questions divided into 8 subsections. And it asks about the last 4 weeks. So a good point to note there, it is about the last 4 weeks, because it means you don't want to ask this question each week, right? Because that doesn't make sense, because then the answers overlap each other. Every month you can do a new quality of life measurement, or every 2 months, but that would be the ideal, that you're following up every month with a new quality of life questionnaire. So what are the 8 subsections? It looks at physical function, limitations due to physical problems. It has a general health perspective. It has a vitality score, a social functioning score, limitations due to emotional problems, general mental health, and a health transitions question. It's, very widely used, valid, reliable, awesome. It's roughly 10 minutes to fill in, so it's very, very easy as well. Highly, highly, highly recommended. Then you've also got this PROMIS 29. This is Patient-Reported Outcome Measurement Information System. So this was developed in the US with the NIH. They formed this cooperative group in late 2004 to transform health measures into this system. So adopting the World Health Organization's tripartite framework of physical health, mental health, and social health being a good quality of life, these PROMIS researchers developed and calibrated these multi-item banks. So this PROMIS 29, it's a short form assessment containing 4 items from each of 7 PROMIS domains. So they look at depression, anxiety, physical function, pain interference, fatigue, sleep disturbance, ability to participate in social life and activities. So you can see it's slightly different than the SF36, and I would say that they're probably both quite complementary. Again, it's quite quick and easy to fill in. Each one of these, you have an intensity from 0 to 10, so you rate it from 0 to 10 in each of these domains. So the PROMIS 29 is like a universal questionnaire again, rather than being disease specific. So anyone over 18, it's good, and you score each of these 7 domains. And I hope you can see again why this would be so relevant to fill in your patients, to see, are they improving in these different domains over time with your care. I want to give you an example here of a study that used the PROMIS 29, and they also filled in the VSQ9, and that was that visit-specific satisfaction questionnaire. And they did this in 343 pregnant patients. So they used the PROMIS 29 to measure quality of life, and they used the VSQ9 to measure visit-specific satisfaction in these 343 pregnant women. And they followed them over a period of chiropractic care. And the chiropractic care consisted of the Webster technique, getting adjusted, their spine subluxations adjusted, and adjunctive therapies. And what was really cool is that their quality of life score significantly improved over that period of chiropractic care. And imagine again if this was documented in thousands and thousands of pregnant women. And what about other populations? What about older adults or parents with children? Can you see how this might be quite important information to get out there into the literature about the outcomes from a patient perspective of chiropractic care? Imagine this recorded in a standardized way. Imagine this recorded electronically in large numbers over long periods of time. I just think it's such an opportunity for our profession. I want to move on now and talk specifically about some mental health patient-reported outcome measures that you can use. But before I do, Again, pause and test yourself just to make sure you're picking up on the key concepts.